Health Watch, the first case of China's new and deadly coronavirus has been reported here in the U.S. According to the CDC, the patient is in his 30s and traveled in November to Wuhan, China, the epicenter of the outbreak. He's currently quarantined at a hospital just north of Seattle. So Carter Evans is outside the hospital. It's in Everett, Washington. Carter, what precautions are doctors taking?
Well, he's in isolation now, as you said. That is just a precaution. This is Providence Regional Medical Center where he is right now. Health officials aren't releasing the man's name, but they are trying to retrace his steps to determine who else might have been exposed.
2 nights ago, the man in his 30s checked into this hospital hours after he was diagnosed with the coronavirus. It was 5 days after he arrived back in the U.S. He contracted the virus while in Wuhan, even though he didn't go to the animal and seafood market where it originated.
He was traveling alone socially, but surrounded by others, and so that is part of the work that's being done to identify who those others in close proximity to him that would need follow-up education and monitoring.
Education and monitoring are 2 of several steps U.S. health officials and the CDC are taking to stop the illness in its tracks after determining it is transmissible from person to person. Major airports in Atlanta and Chicago will be added as screening centers for passengers arriving from Wuhan. Every person coming from that region will be rerouted through one of these 5 airports before they're allowed into the U.S.
If this patient is doing well, we will work closely with our partners at the State Health Department to continue to ensure that we're taking good care of him.
Dr. Nancy Messonnier of the CDC says that even following the first confirmed U.S. case, the global health community is confident the overall risk to the public is low.
Anytime there's emergence of a new disease, it's concerning. But in this particular situation, we've been very proactive in putting in place measures to help protect the American public.
All right, Carter, obviously this is, a public health concern. This is the sort of thing that rises to the level of the president. The president has been particularly busy, but has he talked about this new case at all?
He did talk about it, and he basically said that the U.S. government has a plan. He didn't expand on what that plan is, but we do know that the CDC has added those extra airports as screening centers for people coming into the U.S. from Wuhan, so that is one significant move, and they're making everybody go through those 5 airports now.
I was sort of, now I'm clearly not an expert in this area, I was sort of surprised at how quickly the first case popped up here in the U.S., but I presume authorities are expecting more cases and the possibility that, it could spread.
It's pretty much inevitable at this point. I mean, you've got so many travelers that are going to be coming here from China. As for this patient right now, they say they're keeping him in isolation out of an abundance of caution. They really don't believe he can communicate the disease right now, but anyone that he did come in contact with over the last few days, they're trying to get in touch right now to monitor them for potential symptoms as well.
All right, Carter, thank you very much.